Welcome to the channel Dentistry MDSPreparation. So this is our fifth lecture on reflexes during the child development. So what is a reflex? It is any response which the body produces without thinking about it. Like it is a involuntary action. So there are various reflexes during the child's development. These include Moro's reflex, Startle's reflex, grasp reflex, walking or stepping reflex, limb or foot placement reflex, asymmetric tonic neck reflex, Babinski's reflex, labyrinthine reflex, parachute reflex, Landau reflex, doll's eye reflex, and rooting reflex or placing reflex. So in this lecture, we are going to study about these few reflexes. So the first one is Moro's reflex. How does it get initiated? So whenever there is any sudden movement of the neck of the child, it initiates this reflex. So suppose we are going to carry the baby in our hands and we are moving him from supine to sitting position, and then we let the head fall for some distance. So what will be the reflex activity? He'll start crying and there will be abduction followed by adduction. Like the arms will move outwards and then inwards. Okay. So it appears at birth, disappears by 4 to 5 months of age, and the clinical importance is that if it is absent on one side, it indicates brachial plexus injury or fracture of the shoulder. And if it is absent on both sides, it indicates CNS or spinal cord injury. Then the next one is Startle's reflex. It is similar to Moro's reflex, but now here it is initiated by a sudden noise. So the reflex activity will be the elbows will be flexed and the hands will remain closed. This again appears at birth and this appears by 6 months of age. Clinical importance is that if it persists longer than 6 months of age, it indicates the child is suffering from cerebral palsy. Then the third one is grasp reflex, in which when the child's palm is stimulated or touched, then he closes his hands around that finger. Okay, so it appears again at birth and disappears by 6 months of age. Okay. Then is the walking or stepping reflex. Here, the baby appears to take steps when he is held upright with his feet touching on a solid surface. Okay, so we are holding the baby and we let his feet touch on the surface, and the reflex activity will be he'll start taking steps forward. Okay, so this is the walking or stepping reflex. It appears at birth and disappears by 3 to 5 months of age. And after that, it persists as voluntary standing. It is normal, and this reflex is going to persist in the further life as voluntary standing. Then we have the limb or foot placement reflex. This is when the front of the leg below the knee or the arm below elbow is stimulated. Like the leg below the knee is being touched to a surface in this figure. So the child tries to put the limb over the edge of that surface. So this is the limb or foot placement reflex. So it appears at birth and it disappears by 12 months of age. So these were few of the reflexes during the child's development. Next, other few reflexes we are going to study in the next lecture.